A warm good morning. Prevention is worth the pound of care. Innovators in all areas of healthcare are working hard with the aim to deliver their technologies and potential solutions for patients around the world. The current global pandemic of COVID-19 necessitates a public health strategy with more emphasis on epidemiology, especially with regards to understanding the causes, as well as identifying appropriate population-based behavioral and educational programs. It is important to realize that the pandemic of COVID-19 has initially happened in well-developed countries. However, the virus does not differentiate between rich and poor, rural and urban dichotomies. It is particularly a threat to a country like India, where 65 to 68% of populations live in rural areas that also have the highest overall burden of disease globally. What challenges might lay ahead for the healthcare companies and new startups, and where we can expect the companies to thrive? To speak on this, we have Professor Dr. Ashok Thiakarajan, CEO, Westminster Healthcare, India. Now, I request Dr. R. Kavita, Associate Professor, SIIMS, to introduce the resource person of the day.
Yeah, very good morning to all. This is Dr. R. Kavita, Associate Professor, SIIMS, extending a warm welcome to all the participants for the 4th day of 7-day International FDP on post-COVID-19 challenges and opportunities, a global perspective, hosted by Sakthi Institute of Information and Management Studies, College. I would like to thank our beloved President, Dr. B.K. Krishnaraj Vanavaraya, respected Secretary of the College, Mr. M. Balasubramaniam, respected Director, Dr. P. Subramanian, and Professor Dr. R. Thiagu, Head Academics and Program Coordinator, for their continuous support and guidance in organizing the webinar series. Today, we have Dr. Ashok Thiakarajan, CEO, Westminster Healthcare Lyco Group, India. Dr. Ashok Thiakarajan did his MBA in University of Madras, Master of Law in Madurai Kamaraj University. He has completed MPhil. He did PhD in Human Resource Management and Marketing. He has worked as brand manager, trainer, and general manager in Venture Laboratories Private Limited, Chennai. He worked as project head at Ramaya Institute of Medical Science and Technology, Bangalore. He served as Vice President in Kovai Medical Center and Hospitals Limited and Senior Vice President in Wilroth Hospitals. He served as Administration in Fortis Malar Hospital, Chennai, and Chief Operating Officer in Kerala Institute of Medical Science and Healthcare Global Enterprises. On behalf of SIIMS, I extend a hearty welcome to the resource person, Dr. Ashok Thiakarajan, for having concern to share his expertise knowledge in the field of healthcare sector. I also take this opportunity to welcome all the principals, deans, directors, faculty members of various colleges, professionals, and industry people who are attending this FDP. Thank you. Now, I kindly request Professor Ashok Thiakarajan to take over the session.
Thank you very much, Professor. And first of all, warm welcome, good morning to all the participants for this wonderful session. I take this opportunity to express my gratitude and thanks to the President, Mr. Krishnaraj Vanavaraya. And since I was in Coimbatore for a quite long time, I am well aware of this gentleman who is passionate about building business models. And it's absolutely fantastic to have such an iconic figure to start a B school. I always say it's my mantra to teach the FOB we call family owned business. If you see any business in the world, across the world, everything is family owned, whether it's a Reliance, whether it is a TVS, or whatever you say, it all starts from the family, then it gets built. So FOB is something totally different from the normal thing, where a person comes from the family, business family, and runs a business in a fantastic manner. In Western Tamil Nadu, SIIMS is one of the premier institute. I take this opportunity to thank Mr. Krishnaraj Vanavarayar for giving this wonderful opportunity, and also his experience and expertise in building such a beautiful institution. I also thank all the professors, especially Professor Balasubramaniam, for having coordinated, and Professor Tyagu, and also my mentor, Professor Dr. Chandrasekhar Menon, for having connected me to this beautiful institution. And with this introduction, I would like to go into the subject. And today, we are going to discuss about the hospital challenges and opportunities in a very different atmosphere. You're seeing me without mask. Since I'm sitting in a closed room, I'm not wearing the mask. The COVID pandemic has asked serious questions and posed serious challenges to the businessmen and also to the professionals across the world. How are we going to manage the situation? As a business person, as a P&L head we call, and also as an academician, I am going to throw some questions, and also I'm going to give you some answers. How are we going to face the challenge? And I'm confident that we all will become very successful. We'll come out of this in a very, very, very robust manner. I'm very confident that this pandemic will allow us to understand the nuances of the business models, and also to bring out the new inness, the new ideas, the innovations and the strategies, so that we can work out something very novel and we can win our situation. With this introduction, and only one thing I want to start before the opening of the slides. I have a very strong belief. I'm a direct student of Philip Kotler. I had the great opportunity to study under the father of marketing. I have a very strong belief that the challenges are always there everywhere. And if you see, there are two industries which are growing phenomenally in the world. Whatever happens, one is the arms, which keeps on going. You also know that what's happening around the borders and other things. As long as human beings are there, arms are going to be there. Second one is the healthcare industry, because the bacteria, we always say that, the human being or even the animals, they go on strike, they go for non-cooperation, and they will not, show you the proper attitude which is required to grow. But only one organism in the world which never goes for strike, which never say shut down or road roko, is bacteria. The microorganisms are always there. So that's the reason we say that all the hospitals and pharmaceutical companies and medical devices, we are all 24/7. At any point of time, at some part of the world, there is a doctor who is working, there is a guy who is manufacturing the medicine, and there is a guy, a technician or technical expert who works on the medical devices. So with this brief introduction, and I would like to go into the slide, maybe we'll discuss more along with the slide. Professor, please show the slides. Professor, please share the slides. Yeah, that's nice. Good. So this is about myself, and I got a very strong belief that we have to educate ourselves at every point of time, and we should also ensure that we grow along with the knowledge and also the understanding. So this is my brief introduction. As Professor has already told, I did my science in microbiology, then law, MBA, MPhil, and I have a passion for doing PhD. And also I'm a visiting faculty for various universities, and I have done a lot of sessions. Currently, I'm working as a CEO for Westminster Healthcare, which is a part of Leica Group. And you all know that Leica is one of the biggest thing, Leica Digital, Leica Digitech. And we also one of the biggest film producers. We produced various films, and throughout the globe, the company is present. And next slide, please. Yeah, that's what I said. I got a very strong belief. Every individual, every person, every professional should be in a position to sell themselves. At the end of the day, we are trying to sell ourselves. We are trying to sell our techniques, technologies, and our technical expertise at every point of time. And either you call us a sales or marketing, that is what my teacher says, is that marketing is the ultimate. I belong to the mantra that everything is marketing. I have a very strong belief. You can build the building, and you can bring machineries, you can bring people. At the end of the day, once you make anything, whether it's a product or a service, until and unless you know how to take it to the another person, or how to sell it, or how to make the other person to understand and use it, which is not going to be a successful one. At the end of the day, the marketing is the ultimate, and sales. I know the famous the quote from Philip Kotler is that to understand the need of the customer and suit the need with the product or services what you've got, that is the sales. So I better to the strong mantra, and as a father of marketing, he has given a lot of innovative strategies to the world to develop ourselves and also the company business. Next slide, please. So this one I would like to, I want everyone to have a very good look at this. When everybody says it's going to be a problem, the world is getting into trouble and pandemic is affecting, the GDP is getting dipped. You see that there is still a strong demand. The healthcare market in India is expected to reach 372 billion US dollars by 2022. And also the lifestyle disease, for example, the diabetes, obesity, thyroid, all these things are getting increased. So there is going to be a strong demand in this segment, and attractive opportunities. It is expected to grow at the cumulative growth of 16 to 17%. That's really phenomenal. When we talk about 4%, 5%, if you see even after the pandemic, the India is growing around 6.5% in the service segment. So in the year financial year 2022, it's going to be $4 trillion. So we are talking about $5 trillion business. And the value of merger and acquisition, this is what is very important. If you see the newspaper recently also, the big group, HCG, Healthcare Global, and that has been got a very big investment. It just got a very big investment from CBC Group, around 4,500 crores. So we see that merger, acquisition, joint venture, which are coming. So which is estimated somewhere around 7,615 crore. And most important thing, there were around 90,000 or 82,700 doctors, or around 8 lakh doctors. Now you see that it's around 11 lakh doctors, and there is a continuous demand for doctors, and it's a raising manpower. And the policy support, the world's largest government-funded healthcare scheme, Ayushman Bharat, which has been introduced and which is really good. So it is advantage India. I would like to impress upon everyone that advantage India, and without healthcare, nothing is going to happen. And healthcare is going to be the torch bearer, or it's going to be the bandwagon for the growth of India, not only in India and also for the world. Next slide, please. Yeah, a quick look at this digital health on Indian perspective. Now we talk about digital everywhere. When the lockdown has been introduced, the work from home concept has become very, very popular. If you see the digital intervention in healthcare, which is expected to drive the Indian business by 23% by 2020. And one more important thing, we talk about the problems. You cannot come out because of the lockdown, and there is a pandemic around, and also there is a social distancing. When somebody is becoming sick, you are getting sick, how are you going to get treated? The only way is telemedicine. The telemedicine is going to be the future, and with the 20% growth, and we are going to reach the very high mark in this thing. But still, the telemedicine in nascent stage, and artificial intelligence. Today, everybody is talking, even the IIMs and IITs, we are giving much thrust on this artificial intelligence. which is worth around 6 billion US dollars. If we convert into Indian rupee, 431 or 432 billion by 2021. And if you see this, 76% of healthcare professionals, they already started using the digital health. In those days, we talk about the medical marketing. When somebody goes, we call as a medical representative or a product manager, when he goes to the doctor, we used to carry the literature and papers and exhibit to the doctors, please see it. Those days have gone. Now the tablets have started ruling. In the tablet, you load everything and you are doing it. Even you are able to tell the doctor, fixing up an appointment, everything. If you have a mobile, the world is in your hands. And this is very, very interesting. 4,892 startups in Indian health tech space, which are going to come. And every day, since I am attending a lot of webinars and I'm also addressing a lot of webinars, and every day somebody is developing an app, somebody is developing some chatbots for the healthcare industry, and which is going to be digitized over a period of time. And there is a 504 million between 2014 to 2018, the startups have started making for the India. Next slide, please. Yeah, GDP of health insurance. See, today, this is also another information which I'm giving or a request I'm making. Please go for a medical insurance, which is absolutely important. And medical insurance is going to be a major role. As a hospital administrator, if you see 10 years, 15 years back, we call as a payer mix. The payer mix is nothing but the revenue stream we call in a kitty or in a bundle. What is the contribution of each segment we call? It is broadly divided into 4. One is cash business. The people come, pay cash, and they take the service. The second one is that insurance. The third one, we talk about the public sector or corporates. The fourth one is international business. Earlier, 10, 15 years back, the cash business was dominating. 65 to 70% of the business used to come through the cash. Today, it is getting slowly changed. The composition, the mixture is getting changed. Today, if you see any hospital, it is 50 to almost 40 to 50% is becoming insurance. And insurance, it is going to grow phenomenally. And I'm also telling you as a professor, you can tell your people that there is a great opportunity in the insurance segment. You see the volume, almost 7.39 billion in the year 20 and 2021, 2022, it's going to be much phenomenal. And the hospital segment is estimated to touch 372 billion from 160 billion. And see the growth, it's almost doubled. And we call as exponential growth in healthcare, which is going to happen, which you are going to see that. And if you see the healthcare system in India, especially in foreign countries, in Europe and US, it's totally different. It's all state-run organizations. Whereas in India, the healthcare need is majoritarily serviced by the private hospitals. 74% of the total health, if you see that, which is being managed by the private hospital. And this is another important thing, Indian medical tourism market, which is growing. And it's all because of the technology. And I want to impress upon you that if you see that SIIMS, the business school, it's one of the best because you are able to touch the important topics, or you are able to understand the sensitive subjects and what is very much required on today's context, and you are taking it. Similarly, if you see that India, we are much advanced in healthcare. Our doctors, our nurses, and also our system of managing the patient, or the patient care is much advanced. That's the reason, it is already touched 9 billion, and we are going to see the growth there. And already many people, if you see African market, Middle East, and even from Russia, a large number of patients are coming to India. These are all the opportunities. And merger acquisition, as I said, in the hospital sector, it is jumped by 155%. Next slide, please. Yeah, the opportunity side, I would like to touch upon this virtual reality. Today morning, I happened to see the news. In the temple darshan, people started talking about the virtual darshan and also virtual queue and also the virtual way of getting into that. In Kashi Vishwanath temple, I just happened to hear the news while I was driving the car. The virtual reality is that it allows the medical students virtually into operation theater. For example, we call as that, that any product has to be sterilized before being used upon the human beings. whether it is operation theater or ICU, we do that. So there is a machine called plasma sterilizer. Usually the sterilization is done by steam and also with a chemical, and also atomic energy is being used. And one of the things is called plasma sterilizer, which is very famous there. If you see that, if somebody wants to know how it operates, virtually just you can wear the goggles with the sound, with the computer, you can go inside, you can get inside the machine and you can see how does it work, which are all the parts. And it also helps the support staff. And today I want to tell you that the ICUs, the intensive care units are being managed virtually. And there are platforms, there are experts are available, they do that. And like as I was telling that, the ICU management, many things can be done virtually. See, during this pandemic period, I have tried many things. Physiotherapy, which was able to do virtually. Teleconsultation, OPD, we could do virtually. And then the pharmacy, we were able to get the prescription and we were able to send them the medicine through somebody. And these are all virtual, and everything is virtual. Most of the advices, psychological counseling, and also the problems of dermatology, all these things you can do it through virtual. And these are all the companies which are there, which is being found. So over a period of time, virtual is going to take the healthcare segment in a very big way. Next slide, please. Yeah, this is very, very important. See, when you take the advancement, as I said, we are advancing in a very big way. You all heard about 2D printing, 3D printing. 3D printing can do magical innovation. It can help the doctor in a very big way. For example, if we do the 3D printing of the brain, when I do the CT scan or MRI of the brain or the spinal cord, the 3D printing has given the surgeon the great amount of liberty and also the knowledge to use his skills to exactly go into the place and make the correction what exactly which is needed. And if you see that the real size models for doctors, that is also available for practices. And there are so many things which is developing is that one thing we call is that which is called biomaterials. The biomaterials are the one which are being used in the human being, which are absolutely something they got absorbed and something which remains in the body over a period of time. So the biomaterials and the 3D printing are going to be the future. If you see that the number of companies founded is it's almost 214, and the companies being funded. This is going to be the future, the 3D printing. In fact, there was a big movement in Asia. We wanted to take it up. And for the cancer specialty, this is very, very important. 3D printing over a period of time, if you see every hospital or every healthcare organization will have a 3D printing for them. Next slide, please. Yeah. So this is in terms of opportunities, the innovation, diversification, and the focus on fundamental, which is absolutely essential. Whatever happens, I would like to tell you a small example. When I was working for Johnson & Johnson, you all know that there is an incident called thalidomide incident. Thalidomide was a drug which was tested, which was given to the pregnant woman to take care of the nausea. We call it, maybe in layman terms, it's called vomiting. During the first trimester, first 3 months, every woman used to, when they become pregnant, they used to vomit. The drug was given, then they got into the trouble, there was side effect, and there was a chaos in the market, and everybody was suing the company. At the time, what the Johnson brothers, they did, when there was a problem, when there was a confusion, when nobody knows how to move forward, everybody's shoulders were dropped and they were emotionally, they were down. He said that go back to the fundamentals. So always when you go back to the fundamentals, you will find results. So now today's concept, the cost is the king. So redesigning the operating model, whatever business you are, even as a professor, even colleges, the time has come. We have to redesign our operating model. Gone the days, I have been telling that we talk about virtual and we are going to talk about on-site. Maybe what we are talking today is that you take somebody into the college, but he will never come to the college except for 3 months. You put him directly into a site. He started working, whether it is national or international and all, then he will start doing the virtual thing. Then you have to conquer the new frontiers, diversifying revenue streams, which is very, very important. You see, for example, our president, Dr. Krishnaraj Vanavarayar, started with the textile industry, got into the idea, basically a law graduate, and how the new frontiers are being captured into the business school. So ultimately, you have to diversify your revenue streams, and thereby you can improve, you can do that. And the emerging battlefield, as I said, the retail customer, which is always growing, and you can see how Amazon and Flipkart, they have come, which is going to be the thing. And the evolution of payer, you have to understand about the payer mix, as I said, how the payer behavior and which are all the various nuances which are happening in this field just to be done. So innovation, diversification, and the focus on fundamentals are the three mantras I strongly believe that every strategist or every business leader or every professional, every professor should start thinking and working on that. Next slide, please. Yeah. So now we'll come to the challenges. Now I was talking about, if you see the slides, what was the global market, what was the market size, and what was the potential, what are the opportunities. Then in this today's world, in the pandemic, and also we do not know what is going to happen, something new evolving, that is, I said virtual, the virtual revenue streams and the virtual OPDs and the virtual pharmacies, virtual ICUs, all these things have happened. Now you see the challenges, and you will be surprised that people seeing from outside. So I would like to touch upon certain things. The healthcare industry is evolving. If you see the production manufacturing industry or any other industry, from the F.J. Taylor time, the process have been set in. So that is a clear, HR has got a specific role, finance has got a specific role, marketing has got a specific role. We call it shop floor management. Whereas in the healthcare industry, it is predominantly driven by the doctors. If you see, it is all single man show. If you take even in Coimbatore, our Nalaji Palnisamy, Dr. Nalaji Palnisamy, the veteran, the icon, and Dr. Bhaktavachalam, and then all these doctors only they started the concept of corporate, it started coming. Only in 20-25 years you can see, and Koi Medical Center is far, far superior in terms of technology and usage of these, we call as chatbots, and also other things in a very, very much advanced way. And divided into government, private, corporate, as I said, basically the overall segment is divided. It's a little complicated. And if you see the government business, it's very large. But the challenge is that the payment pattern, getting the money. And private players, absolutely, they are the, as I said, 75% of the needs are being taken care by the private. And corporate and multinationals, the organizations which are getting into the stream. For example, if you see that, totally, if you see the total thing is that the multinational companies like Fortis and Max and Columbia Asia, to a certain extent, if you see this Indian multinational is Apollo, once they started getting into the healthcare business, the thought process is totally changed. We call as FOS, the Fortis operating standards. The process has been set in. We call as a system process integration has started. And largely the revenue is depending on doctors. The doctors are the only one who bring revenues. Rest everything is expenditure. And also there is a complex works in system. I always say that a hospital promotion is basically depend on two pieces. One is that the professionals and the procedure. The professionals are the one, the doctors who decide. So it's predominantly a doctor-driven business. We have seen many organizations, when a doctor leaves, the business goes, the client goes, and then you are into trouble. When you bought big machines and other thing, what is to be done? You need to do that. And procedures, and all these special procedures, heart transplant, lung transplant, stem cell, these are all the areas where the new technology is coming. So these two P's, this is my mantra, the professionals and the procedures are going to be there. The another challenge is the laws. Every day new laws are coming. And right now, according to me, with my limited experience of 3 decades, 169 laws are governing the hospital. A lot of regulations every day. It's good, but at the same time, it brings a lot of difficulties and compulsions to the administrators. Medical legal cases, one of the major problem, and also the Consumer Protection Act. If you see from the patient point of view, consumer's perspective, it is absolutely fantastic. But as an administrator, you will end up in trouble. So what happens is that you are end up in doing so many tests. We always say that when I go with a headache, you are asked to take one X-ray, one CT, so many blood tests, because one of the reasons is medical legal cases. The hospital administrator, the doctor do not want to leave anything. So this is one of the major challenge. Next slide, please. Yeah. As I said, in the operation challenges, if you see the overall hospital, I'm not getting into the overall healthcare, I'm getting into the hospital. Because if you see overall healthcare, this is, as I said, pharmaceutical, which is one of the biggest, then medical devices, then insurance companies, and also hospitals. Predominantly, these are all the major things. If you see that in the hospital, when you see from outside, it is a doctor and the patient, they come and take treatment. They've got some diagnostic equipments like laboratory and radiology. You come and do that. No, it's absolutely not. It's very complex. And these are all the process we are getting into that. These are all getting, it's all happening inside the hospital. People management. If you see HR department, then you call us a security and also the canteen and other thing. There is a big people management is working on. Every hospital, you know that there is a small nursing home we call 30 bedded, 40 bedded, 50 bedded. We call as a primary care. Then you've got secondary care. Then you've got multi-speciality hospital where they treat various type of diseases with 100 beds and all. Then you've got tertiary care hospital. Tertiary care is much more advanced with more beds and more complex surgeries are being performed. Then quaternary care has come. Now it is like a multi-super specialty hospital where lung transplant, heart transplant, or different and difficult procedures are being performed. So where the process plays a major role. The process management, we call as NA-based implementation, JC accreditation, these are all processes are coming into picture. Then clinical management, which is absolutely with the doctors and nurses, which is on the basic thing on the education, what they have done on the clinical practices, that is clinical management. Brand management, as I said, you see the advertisement today, if you see the branding of anything, I can always say that the John Hopkins advertisement, please go through that. And as my teacher always says that, Dr. Philip Kotler, he always says that emotional branding, any branding which has to do with emotional. And today, the emotional branding is very much connected with the hospitals. And financial management, yes, it's very complex and it's very difficult to manage the finances in the hospital because today you buy a machine and it becomes obsolete within a period of 2 years. You are not, you cannot see in the hospital any machine or equipment is being used for a very long time because it becomes obsolete and the techniques are getting changed. So lean management, every institution is teaching about lean management and which is being practiced, and this is a big challenge we have. See, for example, if you see the hospital, it is a labor intense segment. If you need, for example, there are certain ratios. If there is a ward, at least for 10 beds or 15 beds, you need one nurse. And in the ICU, you need one bed, one nurse. That is why if you see everywhere in a hospital, the number of nurses are very huge. So when you want to implement the lean management without compromising the patient care aspects, there is a lot of thought processes required where you can exactly implement the lean process. Then mechanical and biomedical engineering, which is dominating. With the recent advancement, in the technology field, the biomedical engineering is taken to the, for example, in this pandemic period, you can operate your water tanks, you can operate your AC machines by sitting at home virtually because there are tools are available, technology is available. So the mechanical and biomedical engineering has taken a new thing. And this is a big challenge in terms of getting digitalized, getting into the modern era and getting away from the old system. And skill deficiency and EBITDA management, yes, this is the biggest challenge. As I said, getting a proper skill is very, very difficult for the hospital, especially doctors and nurses, paramedical staff, and also your administrators, because it's very complex. EBITDA management, and as a people in the business, they understand that the managing EBITDA in the healthcare in the hospital, it's absolutely becoming complex and very, very difficult. There were times we are talking about 30% EBITDA, 25% EBITDA. Now it's become hardly 10%, 12%. And this is very important. See, if you see that 10 years back, there was no standard for the hospital. Every hospital promoter or an administrator had his own way of functioning and doing it. He used to set his own protocols, what is to be done. So there was a lot of difference among the hospital and the patient care, the way they treat, because every individual used to put in their best practice management and they used to do it. Today, National Accreditation Board for Hospital and this is JCI, these two bodies, one is international, other one is national, they put in a lot of standards. If you see this NABH with 10 chapters, and with the 665 elements, every part of the hospital, every part of the service have been clearly defined. What is the standard, what is to be done, which is really good in terms of patient care and also for the doctors. This is very important. Like, as a professors, we call that the evidence-based and empirically tested. These two things are sacrosanct for the healthcare. Anything which is on the evidence-based, you cannot do any service or any treatment if there is no evidence. That's the reason, no, the alternate medicine, whether it is Ayurvedic, homo, or the homeopathy, they have their own plus, they have their own merits. But as far as the guys who are practicing allopathy, as far as the people who are there in the hospital, we always say that these two aspects are very important, whether there is evidence-based or empirically tested. Next slide, please. Yeah, this is what I was telling. There is a great opportunity when my beloved students come for a project, when they come for intern, they say that, sir, how many hours I have to work, sir? And they think that in a hospital, when they come out of the college, they want to enjoy. There is no problem in that. But I always tell them that in the hospital, there is no holiday. When you say that Saturday, Sunday holiday, we work very busy. When you say Diwali, Pongal, Christmas, Ramjan, you take a holiday where we are very busy, because that is the time many people, they come for massive checkup, they come for appointment. So we always, and I always say that, in any holiday, we never work. The famous quote, I can say that many promoters, they say that, sir, Diwali, you celebrate, next day you come to the hospital. So many times it happens, because as I was telling in the beginning, that the microorganism, they never take a break. They are always there inside, and it is being done. And one more thing is that the great opportunity wise, we have seen the challenges, and the opportunity wise, the post-pandemic growth, we talk about the three types of growth. Either it can be a U curve, or it can be a V curve, or it can be anything. So this is going to be the V curve, which is we are going to see that. And you see that within 60 days or 70 days, once all these things get settled down, and once the fear factor goes, when the people come around, and the corona is being won out by the human race, you can see this, we are going to see the growth. At that time, it's going to be a great opportunity, great challenge. We are not going to get people, and there's going to be a big demand for everything that is going to take place, and that is a great opportunity. And this is very important, transformation through adoption of technologies. Whatever the field you are, whether it is a teaching, whether it is a factory, or whether it is a healthcare, whatever we are, we need to transform ourselves to embrace or to engulf the technology, which is absolutely essential. The days have gone that the old techniques, and I always say that that is one of the point I put. I always invite the professors. I tell them that please come to the hospital, because it is not like factory. It is not like a bank. It is not like a financial institution where you are seeing, because where the people come with a lot of pain. The major objective of any healthcare provider is to alleviate the sufferings of human beings. That's a major objective on which we are working on that. Where everything is there, as I was telling, as a professor, it will be very useful for you to teach how we are using it. From the front office, I always say, when there is a big crowd, your queuing theory, how does it work? You can really see that. And you will be in a position to connect when you are able to tell your student, oh my God, this is the way it has to work. And also the assembly line management. When we talk about assembly line functioning, in the operation theater, there are 30, 40 surgeries in the 7-8 theaters. How are you able to, like a conveyor belt, you are able to arrange everything, wheel in, do the procedure, and wheel out. So these are all, as I said, the adoption, and also the various financial management. And I always say that, like maybe in the second year of MBA, we call the students and we ask them, prepare a business plan. So everything is a strategy. Here, for example, there is a plan. When the patient is getting down in the hospital entrance, how he is being taken care, how he is being transported, how he is able to come inside without any problem. The people who are already sick, or the physically challenged people finding it very difficult to walk through the hospital, how are you able to manage it? The process management, how are we able to do that? And the another aspect is that medical device and Make in India are going to be the future. And the medical devices, I don't know whether it's a fortunate or unfortunate thing, is that in most of the devices, including the ventilators, are not available. It's not being manufactured in India. Now, many people, I always say that, like Murugappa Group, Lakshmi Group, TVS, these are all big Sakthi Group. Like these are all the big groups. They can get into that, and definitely there is a possibility of Make in India. You can make tools. And as I said, the teachers of the future, they are the people. They are the sculptors. They make the student and they make the future. Next slide, please. Yeah. So now comes is that, this is my mobile number. You can call me anytime and all. One thing I would like to impress upon you is that if I have to just, everything, if you have to summarize, as I said, the healthcare industry is worth, so the 5 trillion, the call of the Prime Minister is that $5 trillion business, absolutely possible only with the healthcare, only with the hospital. The second one is that the opportunities are very big. The virtual one, which is going to be the future. We are now talking about the colleges, how we are going to be virtual and how we can transform ourselves to the next stage. And the third thing is that the 3D printing, as I said, how technology adoption is taking place and virtual OPD. And here I want to say something now. If you see this, if you go to any countries, foreign countries, if you go to any big factory like BMW or Benz, there will be a kiosk. Anybody is sick in the factory, you can just get into the kiosk and there everything is available. You can connect to any doctors and you can tell what is your problem, and there is always a temperature monitor inside. They see the temperature, and if you have any old reports, you can give it there. So you get a virtual teleconsultation there, and in 5 minutes you also get your prescription. So that is there, and the prescription also, if you send it to some pharmacy, you will get the medicine also. So everything is going to be virtual, and I will always say that this is a blessing in disguise. We were all talking about, we have been requesting, or we have been telling our colleagues in the healthcare industry to go to virtual thing. But today, the COVID has allowed us, or has given an opportunity to think everything is that in a virtual way. Keep distance, work from home, and which are all the things you can do it in a mechanical, by using the mechanics, which are all things you can use it by digital. For example, if you see the marketing, in those days, like I always say, if there is a campaign, you can see that there is a big camp is being conducted by hospital, hundreds of people will go, doctors will come, we call it a big zamela. That used to be done. So today it is not that. Today it is being done through the social media and your websites. We call us interactive websites. Once you enter into the website, you should know who is the doctor. Immediately you click, you will get an appointment. The next click, the map comes, the route comes, you click there, you want to go there, then you can, from there itself, you can also book your Uber or Ola, everything is available. So everything has come into the fingertips. So this is virtual is going to be the future. And as far as the teaching institutions are concerned, there is a great opportunity in healthcare, and also you can put your students in the interns here and also project management, because this experience you will never get with any other industry. Everything is already, process is set, system is set. Here, this is like, the students can use their imagination. You can do many things here, because there is a great opportunity. As I said, from the entrance to the operation theater, they can introduce any technology, whatever they study over a period of time. All these things, it can be utilized. And this is a great platform to perform. And these are all the great opportunities. Challenges, as I said, only one thing I can request you is that keep yourself away from the problems and also from Corona. Keep distance, which is very good. Social distancing. Wash your hands as many times as possible. Wear a mask when you go outside, and keep yourself safe. Stay positive and never bother about anything. And all these things will pass through. Be brave and be positive, and get into the hospital to understand what's happening. Once you know that, once you come in, you will know that what's happening, then the fear psychosis will go. Otherwise, when you enter into the hospital, people are afraid, and immediately they say, I'm all right, nothing is happening, and nothing is happening to me, I'm all right. It's not like that. And the scientific advancement is helping you to diagnose your disease much early. And now you can't avoid any disease like Corona. You have to get into that over a period of time, because our habits are changed. So at this particular point of time, the hospital will give you the idea, which will give you the confidence, and also the future is going to be there in the healthcare. I think with this, exactly my time is getting over. It is exactly 10:45. I hand over the session to the moderator for questions and other things. Thank you very much.
Thank you very much, sir. It's indeed a very, very informative session. Being the participants from academicians and industry people are a lot. I think that was a very good session for us. Eye-opener in varied areas, sir. Thank you very much. We have a lot of questions, actually. The first question is from the participant named Anunaya. Telemedicine guidance have been put to combat the spread of COVID-19. To what extent do you think it can support the medical staff and the patients in the long run?
Okay, it's a very good question. See, there are two things I want to tell you. One is the Indian side, the other one is that technology adoption. Even though we say, for example, if you see Apollo Hospital is very successful in doing telemedicine. Fortis is doing, even Westminster, we are doing telemedicine, teleconsultation, and also the video conferencing method. Recently, 2 months back, the Indian government has laid down the norms. What's to be done on telemedicine? One thing is that the patient's willingness or come forwardness to come for a teleconsultation, because we have a thing, always we have to go to the patient, doctor, he has to touch it, he has to see that, in Tamil you say Moharasi, Kairasi, all such thing factors are there. But still, telemedicine is the future one. One is that it allows the social distancing. Number two, it gives the calm mind. And number three is that it is glitch-free. There is no hassle. And today, we maintain everything. Today, the law has come. Your records are being maintained. And all your radiological investigation has to come. Then we need to maintain the prescription. So it has to be, a system has been put into place. And only one thing is that from the patient point of view, from the people, you have to come, and every day if you see the advertisement, they say teleconsultation, please pick up the phone, call the doctor and tell you everything. If you want to see the doctor, get into the video mode. Either you go into the webinar, whatever the way in WebEx or whatever is that, get into that, or simply get into the, like Skype and talk to him, and he will understand. It saves a lot of time, money, energy, and the confidence. And as I said, telemedicine is going to be the future, and a lot of chatbots are being developed, a lot of new devices are being developed, a lot of new techniques are going to be developed there. So once the digital improvement or the digital technology, once it started coming, for example, I need to, in a click, I need to get all your records. Virtually, I have to have you here. Then all the other medicines, everything should come. So as a conglomeration or as a combination of everything, we will be able to serve. I think this gives an answer to your question.
Absolutely, sir. The next question is from Vignesh. The law is very ambiguous for e-pharmacy sector. What is your perspective on this?
Could you please repeat the question?
The law is very ambiguous for e-pharmacy.
Okay.
What's your perspective on this, sir?
Okay. See, anything which is good, which has got anything which is coming new, which has got both sides. And the laws are being made, whatever the law, whatever the conditions, or whatever the line border you are giving, is to ensure that there is a safety between two things, or there is a safety is ensured. In e-pharmacy, there is a big challenge is that implementation. That is, for example, you should get the prescription. It has to be genuine. The doctor, it has to be from a doctor. And the medicine, what you get, we call a Schedule H drugs. And there are so many medicines which has to be given only with the prescription. And with all these things, there is always a challenge. As I said, once the telemedicine is developed, then naturally it will be easy. For example, once you have a telemedicine, maybe you can create an ID or a block. So through that, everything can be routed. So definitely e-pharmacy is going to be the future. In fact, even Westminster, our chairman was very passionate about it. He said that, Professor Ashok, we need to do something on that. We have to do it. It is going to be the future because you need not get into pharmacy. See, for example, in abroad, for example, the operation theater, when I was working there in Singapore or US, you need not stock anything. The theater stocks, whatever I require is being stocked by the manufacturer. For example, if I do 10 surgeries, if I use 30 sutures per day, and the manufacturer, Ethicon, they calculate what is the suture required and they maintain the stock. Maybe we talk about zero inventory. It's available there. So like that, Once you do that, even the complete your manufacturing process, your distribution process, everything is streamlined. And if a diabetic patient taking some medicine, then accordingly, even the economy can be planned. You know, how many patients, what is the milligram they take, how much is required, when it has to come, so it can be done. You are absolutely right. There are laws are there. It has to evolve. As I said, healthcare industry, we have to go a long way in evolving ourselves. I'm confident that, like a telemedicine, this e-pharmacy is going to be the future. Thank you.
Thank you, sir. There is a question from a participant named Arul Moli. What is the scope of health tourism in India amid this COVID lockdown and all this happening around? What will be the scope of the health tourism? Because India is a huge market for health tourism.
Yeah, good, very good question, because I appreciate that. In my presentation, I made it very clear that, the medical tourism is the one which is very, very important, which is growing very well. If you see that, I can tell with my own experience, in my experience of working in MS Ramaya, Goa Medical Center, Fortis Hospital and all. In early, if you take that last decade, 2010, 2008, 9, hardly a few patients used to come. And tier 2 cities, tier 3 cities, very difficult to get medical tourism people, even though we had excellent surgeons and top class, world class surgeons from US and UK, all such stuff. But today what is happening is that our technology has developed and we are having excellent doctors, excellent schools, excellent medical colleges. So this has allowed the pool of talent and also the latest equipments. See, for example, if you see HCG Cancer Center, they got robotic surgery and there are doctors who perform. And even the technology has developed in such a way that it gone into the genetics. So we test all the family members and we tell them that whether you will get cancer or not, or what is the precaution you should take over a period of time. So this particular technology and other thing, it is going to be the future where you can get into many things. So this medical tourism is one of the major things. And I would request all the participants or guide your people that get into that. Yes, COVID pandemic is there. It's not going to go, we have seen Ebola, we have seen many things. So this will be there for some time. But once the COVID goes, it'll go. And one more thing, please understand today, let COVID remains there, no problem. But still, the world will find its own way to do that. So do you mean to say that we are not doing the surgeries? We are doing everything. Surgeries are taking place and deliveries are taking place. Everything is taking place. But as I said, we will find the way. The human beings or the human brain is absolutely fantastic. We will find our own way. Medical tourism is going to be the future. It's going to stay, and India is going to be the bandwagon in this particular segment.
Very well, positively explained, sir. Thank you. There is a question from Vishal Tiwari. How is the health sector going to overcome the skill deficiency that has been experienced during the COVID pandemic? How much is going to be the difference in the private and the government healthcare sector, especially in the technology? There is a huge skill deficiency experienced across the globe, not only in India, that's being realized even in the developed countries. During the pandemic, how do you think the healthcare sector can fill in that gap to overcome the deficiency in skills?
Another good question. That's what in the beginning when I said, from my heart, from the bottom of my heart, I thanked the president, Mr. Krishnaraj Vanavaraya, because these are all the iconic figures which they are going to help us to fill the gaps. The institutions and the industry, we call as the combination or the handshaking of institution and the industry, which is very important. Yes, there is going to be a big problem in the skill. For example, I can tell you one small example. If somebody is going to the ICU, whether you are going to be called as intubation, putting up the ventilator, using them, and second one is that open airways. So these are all a lot of complex, techniques are involved, technology is involved. We need to skill the people, and which is always a problem. You guys, you may be thinking that the small job in the hospital is that going and then we call as housekeeping, cleaning. It's a big science. I always tell the people, when the people come for a job, mainly the students, they say that what job you want? They say, sir, I want in quality, I want in HR. Some people, they say want, some people, they say generally operation. Nobody wants this one. I want engineering. Nobody say that I want housekeeping. Nobody say I want front office. They feel these are all very tough job. I don't want this thing. I'm telling you, the American Hospital Association, way back in the year 1997, I had the great opportunity to study a course in the University of Michigan in those days. And I'm telling you, it's a science. Cleaning of hospital is a science. The definition for housekeeping is that to reduce the number of microorganisms in the hospital environment. That is the definition. It's not easy. The doctors, what they do, they remove the microorganism from the body through medicine, through the surgical techniques. So like this, as you rightly said, the skill, you cannot be choosy that I want only one thing, because it's all, they think that, okay, I want quality. It is a cushy work. I can go and tell the people you do that and all. Yes, there is a need for skill. That's what I'm saying, opportunity. Healthcare is going to use the talents like you, including the professors. For example, business analytics. My famous mentor, Professor Dr. Chandrasekhar Menon, says business analytics, artificial intelligence are going to be the two eyes of the industry, especially hospital industry. I need these skills, and we need people. So yes, there is going to be the depth of talent, but there is no going to be the depth of students. There are institutions, there are iconic figures like our president who are going to bring students, and our beloved professors. They are putting their soul, they are putting their efforts to create the beautiful students. So I am confident that India will emerge in a very big way as a leader. You wait and see. And China is not going to be the trade leader, and India is going to be the leader. A little adjustments here and there, and these niggles all will pass.
Thank you very much, sir. We'll go with one more question, one last question from the participant named Vanati. There is always a big debate in India in taking the type of medicine in regard to allopathy versus Ayush treatment. How do you think the awareness can be created, and what is the role of government in taking this awareness to the rural part of India?
It's again a good question and a big challenge. I can put it in a very jovial way. If you are getting married, your wife is also important, mother is also important, your grandmother is also important. Your wife always wants pizzas, burgers, mushroom biryani. Okay, your wife. Your mother says is that take this rasam, take this sambar, don't take outside. If you take your grandmother, she says take kashayam, take all these things. But you need a combination. That's what I want to say. You need your wife, you need your mother, you need your mother-in-law, you need your grandmother. India has got a time-tested way of doing things over a period of centuries after century. Agastya, or whomsoever you say, Siddha Purushas, all these people, they have given an excellent way of the living along with the nature. Food is the medicine we always call, and especially the Tamil culture, what we have, using the traditional herbs. It has got its own values. I am not technically competent enough to give the insight. If you ask about science, if you talk about modern medicine, since I know that I can tell, but I have very limited experience or knowledge about Siddha, homeopathy and all. See, for example, today, if you would have read the newspaper, what is happening for COVID? We give a combination of treatment. You see the government hospital everywhere, arsenic album is given, Kavasura Kudinir is given, it just got its own value. I'm telling you that. Living along with the nature. So if you see, these are all different, like fingers. If you ask me which finger is better, which finger is not that, but I always say use the 5-finger mechanism. Use everything together. What is best, what is not. But as I said, anything which has got evidence-based, which has got empirically tested in their own way of doing it, it is good. Otherwise, I have a very strong belief that, like Palachi Elani, and also that Coimbatore chicken, and also the Chennai way of eating things, these are all totally different. And herbs and homeopathy, Unani, Ayurveda, these are all going to be there. But only one thing is that it should be evidence-based, empirically tested. It has to be scientifically proved with the data, then absolutely it can be used. Thank you very much.
It was a wonderful explanation, sir. I think no one would have ever explained it in the best way you have done. You have brought a smile on the face of all the participants, I suppose. Thank you so much. It is an honor in having you joining a part of the International FDP session of SIIMS. It was wonderfully explained. We are all enjoyed and understood the challenges and also the more of opportunities that is being in the healthcare sector. Thank you very much, sir, for joining us. It is a pleasure having you at SIIMS.
So thank you very much, my dear faculties, especially Professor Thiagu and all the participants. Sorry, I have missed some of the names. And my heartfelt thanks to Mr. Krishnaraj, Dr. Krishnaraj Vanavarayan. I used to meet him when I was in Koy Medical Center and Hospital 1 or 2 times. A great scholar and iconic figure. I thank the institution and each and every one of you for having given me an opportunity. So virtually, I have been talking to you. So virtually, I think I'm confident that I have touched your hearts. Thanks for the opportunity. I look forward to meeting you soon with the help of God. Thank you very much. Thanks a lot. Have a great day. Be fearless, and we will come out of everything very successfully. Success is ours. Thank you very much.
Thank you very much, sir. I request all the participants to take up the feedback form that's being posted in the chat box, comment box, and the description box. The form is in the chat box, comment box, and the description box. Kindly fill in the form. We will be meeting tomorrow with another exciting session on classes in cloud, new normal scenario in education by Dr. R. Chandrasekhar Menon, Dean, Coimbatore Institute of Management and Technology. Thank you for joining SIIMS again. See you tomorrow. Thank you.